Welcome everyone who's joining us. We're just going to wait a few minutes for people to trickle in. I can see the participants numbers going up, so we'll just give it a few minutes and then we'll get started. Thanks everybody. Hey everybody, thanks everyone for joining us today. I can see that we have over 70 participants already signed on, so we're going to get underway because I know this is folks' lunch hour. We want to be really respectful of your time today. So thanks everybody for joining us for this session about licensed home childcare and the new Ontario childcare funding approach. My name is Carolyn Ferns, and I'm the policy coordinator at the Ontario Coalition for Better Childcare. And this is a panel discussion that's hosted today by the Coalition, along with the Association of Early Childhood Educators and the Home Childcare Association of Ontario. And the Coalition and AACO, we held a session a few weeks back about the childcare funding formula that was specific to centers, but we thought, we really want to partner with those who know a lot and day to day about home childcare. So partnering with the Home Childcare Association of Ontario today. And we have an exciting panel with folks who really know the nuts and bolts about home childcare. And so we're going to get into that in a minute. But before we get started, I just want to start our session today in a good way with by acknowledging the land. So our organizations and all of us here on the call probably today are situated on the traditional land covered by the Dish with One Spoon Wampum Belt Covenant. The Dish with One Spoon is a treaty that binds us all to share and care for the land. This land is home to many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And it's now home to many diverse First Nations, including Inuit and Métis peoples. And we're grateful to all of these nations for their historic and ongoing stewardship of this land. And as a settler on this land myself, who's benefited from existing on this land, I recognize my commitment to protect the land, including the water and non-human beings. And through meeting here today, we're engaged in social action that's only possible because of our access to these Indigenous lands. So by coming together today in a good way, we hope to find solidarity and feel galvanized to continue doing this important work. Thank you everybody for joining us today. We've got a really simple agenda today. I'm just going to open by setting some context for what where our discussion's happening. And then we're going to have a facilitated panel discussion led by Alana Powell from the Association of Early Childhood Educators. We're going to have some questions and answers. Thanks to folks who sent in questions ahead of time, but you're also, you can submit questions to us through the question and answer feature on the webinar. So you can do that as the panel discussion goes along, and I'll be harvesting your questions and we'll be putting them to the panelists after the discussion. And then we'll talk about some next steps, resources and follow-ups that we might be doing. So, so that's our agenda for today. And just to situate the discussion today in the context of where we are with childcare in Ontario, of course, where Ontario is signed on to the Canada-wide Early Learning and Childcare Plan, and they did that back in 2022. And since Ontario signed on, the province has been looking at how to develop a funding formula that makes sense for the implementation of Canada-wide here in Ontario, the 10-a-day plan. but it took some time for that to happen, right? So we saw the first cost-based funding formula proposed by Ontario back in the spring of 2022, but that wasn't implemented. And then we saw a fee replacement approach between 2022 and 2024. I guess it's going to go to the start of 2025 because we're still doing it now. But many childcare centers and home childcare agencies and providers really struggled with that fee replacement approach, especially as inflation went up and costs went up, but it really wasn't keeping pace with what providers' real costs were. So there was a public discussion paper on funding formula in 2023 that folks probably submitted responses to. There's been a minister's advisory group on the funding formula. And finally, in August 15th, back in the summer, the new funding guidelines were released for implementation starting January 2025. And since that happened, you know, all of our organizations here have been trying to be in touch with our members, hear their early responses and the questions that they have. We've been approaching ministry for clarification. I think we'll probably hear a bit more of that in the panel discussion, but really doing our utmost to make sure that this new funding approach is implemented in the best way to support children, families, our childcare workforce, home childcare providers and early childhood educators across our sector to make sure that this goes forward in the best way. And this discussion today is part of that, right? You know, we want to hear from our panelists now about what's working, what the successes, what the challenges are, and then also hear from you about your questions so we can then take back, get answers to, and we can talk together on how we might take some collective action as well. So without further ado, I'm going to move to our panel discussion. I'm going to stop sharing our screen and I am going to spotlight our wonderful panelists and we'll get started with our panel discussion.
Amazing. Thanks so much, Carolyn, and thanks for setting that context, and thanks to all of you for being here and to our wonderful panelists. We're going to start by just passing it around and giving everyone an opportunity to introduce yourself, tell us where you're coming from, who you're representing, and then we'll dig into some of the more content-related questions. So Brenda, why don't you go ahead and introduce yourself to everyone?
Great. Hello, everyone. My name is Brenda Ferguson. I'm coming to you today as the board president of the Home Childcare Association. Additionally, I am the CEO of Today's Family, and we offer home childcare and other early learning and childcare programs in 5 municipalities in Ontario. Thank you.
Thanks, Brenda. And Mary Lou, over to you.
Good afternoon, everyone. My name's Mary Lou Mahar, and I come to you from Family Daycare Services. We are a multi-service agency. I am the program manager for our licensed home childcare program, providing care to children in 3 regions, Toronto, Peel, and York. So it's nice to be here with all of you today.
Thanks, Mary Lou. And Erin, last but not least, over to you.
Hi, everyone. My name is Aaron Daly, and I'm coming to you from Compass Early Learning and Care. We are a multi-site operator, and as well, we also have, we operate home childcare in 4 different municipalities. So looking forward to chatting with the panel today.
That's so great. A wealth of experience in different regions and in multiple regions at the same time. So I think you have a lot of knowledge to share, and we're really grateful that you decided to join us today. So our first question, maybe to get us started at a high level before we dig into the funding approach and what it means, maybe let's start by talking about why it's so important for licensed home childcare that the funding formula gets it right, and why it's important that it's distinct for licensed home childcare as well. So maybe, Erin, I'll pass it to you to start that question off since we just ended with you.
Sure. It's such an important conversation to be having right now is to get this funding formula right. When we're talking about sort of this industry's goals of getting more access to home childcare in general, probably the quickest way to do that is with home childcare. It's more easily expanded, and especially in rural communities where it's harder to find childcare centers, we often rely on home childcare to fund that, to bridge that gap between no childcare versus having childcare, and better yet, to have licensed home childcare, which is so important from a quality perspective. That's sort of the really important aspects of it, because we really want to make sure that this is a viable option for providers and to make sure that they're being adequately compensated. It's a very important part of growing and expanding and having spaces for families.
Thanks, Erin. I feel like you just gave us a great overview of sort of all the different dynamics at play when we're talking
Yep.
about why home childcare matters so much right now. Brenda, you have two unique perspectives you're bringing to this conversation, provincially and also from your own organization. So tell us a bit about your thoughts on why it's so important to get the funding formula right.
Erin did a really great job of covering a lot of those pieces. What I think, is important in this conversation, in particular to home childcare and for center-based as well, is we're building a system, and this has never existed before. So this opportunity to build a system that is, the goal is that there's access to early learning and childcare for families across Canada. In Ontario, we have 40% of the population lives here. So the other provinces are also looking to us to see if we're getting this right. And licensed home childcare is such an important part of the model, especially when it comes to parent choice. The opportunity for families that, we have care that happens in your neighborhood and homes. We can easily scale up to meet the needs, as Erin was talking about. Non-traditional hours of care are better served in homes. It's just it's less institutional. Our providers do incredible work, and as we build this to recognize the importance of the providers, just as we do with our staff as educators in the system, this is the opportunity to get this right and build what we want for children and families, both in Ontario and broader in Canada. So there's so much for us to consider to do what's best for everybody.
Yeah, thank you. I see
Mhm.
everybody's nodding along with you, Brenda, but that, the perspective of the system building and really holding to what we want the future to be and how home childcare has a special place in that. Mary Lou, what do you think?
I just, everything that Erin and Brenda have said, I would definitely agree with. And I think for me, the big part of this is the impact of licensed home childcare on the sector. It's such a unique form of care with the small group sizes, with flexibility, with its ability to support children with extra support needs in that small group with individualized attention. And I think just the impact is so broad. Its impact is on families, the workforce, and inevitably children. So we just need to get it right and be part of a valuable system in the province and across Canada.
Thanks, Mary Lou. And you touched, I think each of you sort of in your own way touched on something which leads into this next question, and feel free if you feel like you've already answered it, let us know. But licensed home childcare offers something unique, right? And you've sort of all mentioned it a bit. There's, rural responsiveness, a unique form of care, non-standard hours. So tell us a bit about what makes licensed home childcare a really quality program and why we should be making sure that everyone across the province sees this as essential for system building. What does it offer us in this moment? If you can tell us just a bit more about that. And maybe I'll go, Brenda, over to you to lead us off on this one.
Thanks, Alana. I think, when we talked a little bit earlier about the uniqueness of availability of hours of care, of that small group setting, intimate care that can be in neighborhoods that has obviously a high level of oversight, support, and mentorship in the role. Additionally, I'll use my organization as an example. We provide licensed home childcare in 23 different languages. So being able to meet the needs of the community, the families, values, cultures, is also a really important point. One of the other things I'd like to bring up from a uniqueness standpoint is that when we're talking about childcare and we talk about licensed childcare, there's center-based and home-based. However, there's also an unlicensed component of home childcare where people are opening their homes with children, up to 5 children in their care. They're not getting the value and the benefits of oversight and support and appropriate child development as you're seeing in center-based care. And there's an opportunity in this uniqueness to really, like, we need to pay attention to that, because yes, we have, you know, current space for, I'm going to say approximately 30% of children in care in Ontario for available spaces. The goal is 37%. There is also still from a market-based standpoint, families that still require care who aren't in that licensed care. So I think, you know, that piece of uniqueness to know that we're supporting, you know, families in this model of care and paying attention to how to help shift that dynamic so that even more families have access to that high quality licensed home childcare.
Yeah, thanks, Brenda. And I feel like now is really a moment where that opportunity is there, and making sure the funding formula gets it right makes that more possible. Erin, anything to add to that sort of quality piece from your perspective?
Yes, when Brenda was speaking, it really it also resonates with me too, that from a provider perspective as well, to be part of an agency is also the support aspects of it. And with that, the funding formula also offers supports for agencies to be able to have home visitors in place. But just to have that support, like I know at Compass we offer a lot of supports through our home childcare providers, and also like lending libraries and all of these other resources to help with the quality aspects of providing home childcare. I think that's also another really important piece to get that right, and also to have that funding available to have those resources for home childcare providers as well, so they don't feel so alone as they might feel in unlicensed home childcare. It's one of the aspects I was thinking of too.
That support for the provider is so important. And I know that came up in our conversations, and we'll talk a bit more about that today too. Mary Lou, anything to add to that piece?
Yeah, just adding to what Erin has said, I think for sure there's the agency support of providers within the licensed sector, but there's also the affiliated partnerships that agencies have with others in the community that licensed providers also have access to and can build their own resources from, and inevitably grow in their own professions. So I think it's about the agency support as well as what the community can provide them, that communities that are affiliated with the agencies.
The community is so important. I mean, that's why this system matters. It's what it should be designed around. And so it's beautiful to hear about how those networks of support are so critical. Okay, so I'm going to move us now into the funding approach, because I know for many of our participants who've joined us today, they're really curious for us to dig in to what's going on in Ontario right now. So we're going to start by talking about the challenges. What are you concerned about? A new funding approach, a lot of uncertainty. And what are the biggest things that you're thinking about, you're wondering about, and you're trying to troubleshoot in your own organizations? And maybe Mary Lou, we'll start off with you on this one.
Thanks, Alana. You know, I mean, we want to have a sustainable funding model that really helps agencies and operators to be able to afford their legitimate costs. I think probably one of the biggest concerns that has come forward is some of the established benchmarks. You know, the establishment of the provider compensation to be $155. I think it's $155.02 per provider, with the assumption that providers are having maybe 3 children in their home that are in that 0 to 5 age range. And that's concerning, because many operators have providers that are caring for children, up to 6 children in their homes. So the sort of inadequacy of that amount of money is a huge concern. I would say that's one of the bigger concerns. There's also the geographic adjustment factor from geographic location to geographic location. You know, a concern about what that looks like. Is it adequate? How has it been determined? Is the determination adequate? And does it make sense that in one area they're receiving this type of geographic adjustment funding, and in another area it's different, and should it be, especially when the geographic locations could be side by side, those types of things. So I think those are some of the big concerns that we've been addressing.
Thanks. That's great to get us started. I saw Brenda nodding along with you. So Brenda, I'll pass it over to you.
Great, thank you. I think as we look at the funding formula, one thing I can say is that I'm sure that there's been no provincial bureaucrat who's ever got a funding formula right on the first try, whether it's childcare, other sectors. And putting this together, I'm sure, is tricky. And when we look at this, I think, you know, Mary Lou was really clear on the benchmark piece. So the benchmark piece of being 155 and change per day is, it just is an unusual piece to start with as the number. And we know that everything has to start somewhere. It's based on some survey data that came out in 2023. However, the uniqueness of home childcare is that with having up to 6 children in care, that can vary month to month of the age groups of the children. So you may have, maybe when the survey was done, maybe there was an average of 3 children of the 6 children who were of CWELC age who were going to be able to be accessing this funding and care. And then the rest may have been 6 to 12, but that is a fluid piece. And so when you have a fluid piece and you have a static number, that adjustment of what's that going to look like from is it a month-to-month piece? Do we review this quarterly? That fluidity is an important part of the conversation for us to better understand. And also for our municipalities, because we know that they're all working through that. You know, will this address the true costs? Well, I think that when you think about agencies and organizations, that the funding formula will cover, in theory, approximately 50% of organizations for their true costs of funding or their you know, cost-based funding formula. However, there's then 50% of organizations it's not going to cover that. And so those 50% of organizations are organizations that have been established for a while, running licensed home childcare in a municipality, have established costs in place. However, you know, it's not clear how much is in legacy funding. I mean, so will there be enough money to address the true costs is a really important part of the question. I mean, we're coming into that in good faith under the presumption and assumption that there will be. So organizations who are in that legacy funding component should be able to be covered for those true costs. However, the other tricky part of it being a 2023 benchmark, financially speaking, is that all of these costs have went up, no different than Centricare, no different than your own, you know, your own home budget. Are we covering the true cost of food? Are we covering the true cost of consumables? Are we going to be able to further compensate the home childcare providers? Our home childcare providers, educators, are the sole person in their home. So they are the person who is the educator. They are the cook. They are their, you know, their day-to-day basic administration. They are cleaning up their day and their hours of care. Fundamentally, even if you have a child in care for, let's say, 8 hours, in reality, they're providing 10 hours of service when it comes to the other things that they're doing. And looking at how we're going to, you know, continue to incentivize providers to be part of the sector to, one, cover their costs, earn a decent living in their compensation. However, that piece factoring in earlier when we talk about unlicensed home childcare providers, we want to be able to have more of them join the licensed sector for the ultimate benefit of children and families and the providers. However, if they're going to lose a fundamental part of their compensation, that incentivization to bring more over to further build that sector comes to a halt if we're not adequately compensating providers.
touched on so many important things that I have some follow-up questions for you. But Erin, I want to give you an opportunity to share with us too your your initial concerns, what you think the challenges will be, and then we'll dig a bit into some of what you've already talked about.
Yeah, for sure. Yeah, Mary Lou and Brenda really summed it up quite nicely, a lot of the big concerns. One of the other concerns for me is sort of the inequities that have been sort of brought into this funding formula, and maybe an simplification of what home childcare is. I know that was one of the goals of the funding formula, was to make it simple and easy. But I think in the case of home childcare, it's been oversimplified. Not taking into account overnight rates, longer days, weekend care. Those are not factored into this $155 a day. And from an agency perspective as well, regardless of the size of an agency, there's a $75,000 agency amount you just get. If you have one home childcare provider in your agency, you get the same amount as versus if you are like Brenda, who has operating in 5 municipalities, she also gets that same $75,000. There's a lot of gaps there, and a lot of inequities built in for in this funding for it. So I think that's something that we find challenging as well. But I think, yeah, Brenda and Mary Lou really summed up a lot of those other key points. And of course, relying on legacy funding to hopefully cover those gaps is the big question mark right now for us, is there going to be enough legacy funding? So I think all those points were covered. So yeah.
And Erin, you brought up something I sort of wanted to ask about, because I can hear, from everyone's comments, this uncertainty around legacy funding and if it's going to be enough. And I know in terms of the funding formula for childcare programs, we've been saying this is built on artificially low costs to begin with, right? Like those costs have been forced down by the market approach. So to build those into the system seems problematic in and of itself. And Erin, you mentioned like the inequities that are being brought into this funding formula. And I'm wondering if you can just tell us a bit more for folks who may not know, like, what are those? Like, where do you think that there's room to really address what the actual costs could be, as opposed to just building off survey data from 2023?
Yeah, so some of the thoughts that we've been working through here at Compass were, sort of changing that model to having an amount per child per day, rather than just a flat $155 one amount for a day, regardless of how many children you have. So bringing in that aspect of, if you have CWIC eligible children in your home and you have 6 of them, then you'd be funded for those 6, versus kind of right now it feels like you're a bit of a guess that 155, because you're going to have 3 kids maybe that are under CWIC and maybe 3 that are maybe school age. That's one of the ways we've been thinking about it, is to change that sort of model to a per day per child. And then having some sort of multiplier in there if they are doing extended days or weekends or overnights or something like that. So something that's still very easy to use, but maybe isn't such an oversimplification that it is as it currently stands.
That's really helpful. Mary Lou, are you seeing any of this too on your side, how these inequities are coming forward?
Yeah, for sure. And I think, as Erin has mentioned, we do need to look at this. And also a concern is that we are using 2023 benchmarks. A lot of things have changed in 2024. And I think we also need to look at expected enrollments. A lot of times it's not about our actual enrollment. Our enrollments in home childcare are very fluid. They're changing day to day. And so I think when we're looking at funding, we need to look at expected enrollments. What could they look like? Because looking at current enrollments is as good as looking at today. So I think the expected enrollments need to be looked at. And as Erin has said, maybe looking at something at a per day per child might be more equitable as far as funding.
Great. And Brenda, I'm going to pass it to you, but a question just came through that I think it might be helpful to address, and perhaps you can in your comments too. Someone said, they're not quite understanding this. Is it the case that they're asking us to care for 6 but be paid for 3? So I know there's this complexity between CWELC children and non-CWELC. Can you maybe dig into that a little bit too in your comments around these inequities?
And that's a really good question. And I think that's, very indicative of where we are as a sector. I think there's a couple things as we look at the funding formula that I would encourage people to think about. So 155 is the benchmark. It's fundamentally based on 3. However, give or take with legacy. Is that the right number for 3 children of care? Well, I think that depends on what your current per diems are that families are paying and your providers are being compensated for. You still will be able to have the ability for the children aged 6 to 12 who aren't currently in CWELC, that billing will still continue. And I say this with confidence, even though we haven't, had full confirmation that if you have 6 children in care and they're all CWELC age, it's going to be covered in legacy funding. However, inherently messy, right? So having that flat fee of saying a benchmark base rate of $155 a day is hard. It's a lot messier than the center-based piece. And as Aaron was talking earlier, and how we all currently run is under a per diem base that, whatever the per diem is for your infant toddlers, your preschoolers, your school agers, you can figure that out with a bit more certainty. So it's an interesting way to roll this piece out for us to all better understand how this is going to work. I think that it's going to be messy, and it's going to be messy until it's not. And I think that that's part of the, it's cold comfort as we're saying that. However, we have to work through this for at least a quarter as agencies to understand this and then bring forward our pieces. And each one of us has an obligation to work with the municipality you're with, who hopefully understands home childcare, enough because they've been the service system manager to work through these idiosyncrasies around this. And I hope that we come to a clearer way of covering those actual costs. The benchmark is a benchmark. And so that doesn't mean that everyone's there. And it doesn't also mean, in my interpretation, that if it's $155 a day and you have 1 child in care, that you're going to get $155 a day. I do not see that in the iteration. I understand that it can be interpreted that way, but in the reality, then, people would just have 1 child in their home. And I don't think that's system building. I think it's just a spot where they chose to start, which understanding home childcare funding is complex, both for the province, municipalities. I mean, as agencies, we understand this more. And I hope that as we, continue the conversation with the province, we can come to an even better way of doing it. But I think in its first iteration, it's going to be messy. However, the other thing I will remind people of is that I know there's also a worry, and it's probably one of the questions in here, is that there is no intentionality for any provider to be making less. So as we worry about this $155 a day, it's a benchmark. You may be here, you may be here, you may be below the benchmark, but the intentionality is that no provider of any organization that's already enrolled in CWELC and part of this, that any providers will be making less. However, we want to make sure that all of those true costs are incorporated into this conversation. And that's what we're all going to be learning more about over the next few weeks.
We had planned to sort of move to another question, but the questions that are coming through here in the chat, I think, are relevant to a lot of these concerns. So if it's okay, I'm just going to start to sort of pull out some of these questions, because we had heard from someone ahead of time who had sent a question in advance, just saying, they were concerned, like, what do we actually do if we don't have enough funding? Like, what's the reconciliation process? Are we worried about that? And I see a question here from someone who's here right now saying, what are your concerns over the application and reconciliation process for parent-based fee revenue, specifically in relation to reconciliation? I'm going to keep reading. Currently, it appears that our funding will be reconciled by actual numbers, but there is no process to reconcile the base fee revenue that will be deducted from our funding allocation. Do you feel this is manageable with the legacy or new license amounts we will receive? maybe I'll open it up to anyone who feels like they want to jump in and talk about that reconciliation process and what they're
I
thinking.
can chat about that a bit. One thing we don't know is what reconciliation is going to look like yet. So that is a major concern for sure. Since we don't know what that is, we've taken the approach of whatever the formula has built in. So if you have certain number of children times the number of days and the parent fee rate, that is what we're using and taking 90% of that. That's what the funding formula is. That's sort of all the data we have to go on at this very moment. It'll be really interesting to see what reconciliation will look like. From our municipalities that we're hearing from is that there's going to be multiple reconciliations throughout the year and at different times, so that it's not, you're going to not go the entire year without knowing this. It's hopeful that you're going to actually hopefully see it at least quarterly, maybe quarterly for this year, potentially mid-year sometime. So I'm hoping that that will give us a little bit more information as we move through this year of what that's going to look like by the time we get to the end of the year, when we're actually doing the final reconciliation on that.
Thanks, Erin. Did anyone want to add to Erin's response to that?
I think, it is tricky right now, and without knowing, you don't know your I mean, you have a benchmark of what your allocation is. Many of us still have to meet with our municipalities. We don't know what reconciliation looks like. However, built into the guidelines is a minimum of a mid-year, once a year review of the funding formula and if it's working or not. And I would remind people of that's in there. And the other piece I think I would remind people of when we're looking at this, because it can be overwhelming. I know we've been working through our systems as well with that, is to have that where these conversations currently need to reside is with your municipality or your DSAP, and having these conversations, because equally they got the funding formula information at the same time we did. So they didn't have, an advanced, knowledge or notice of what this was going to look like either. So we're both in the boat at the same time, trying to figure out which direction to paddle with this information. So a lot of this is going to be in that relationship with your municipality. And I think having some conversations about what those true costs are, and that's really part of when they're rolling out the allocations that we're going to see. My guess is that for those who haven't had chance to meet with their municipalities, and my organization is one of them, being in 5, is that they're going to roll out the funding in January with what they think it is, and they're not going to shortchange us on these pieces. And if there's something that you see of like, well, that's not even covering my costs close to that, reach out to the municipality, and that relationship is critical in the oversight of this. Not just as a service system manager from, quality of care, but the service system manager from a funding standpoint. So I think it's really important to, work hand in hand with our municipalities on this rollout.
Mary Lou, did you want to add anything to that?
I think, Alana, what Erin and Brenda have covered is where we're at. And I think it's a work in progress. As Brenda said, I think we had to start somewhere. We did, and there's a lot of uncertainties out there. And I think our municipalities are with us. There's still things that they don't know how are going to be implemented moving forward. But I sense in initial conversations with our municipalities, I think there's a sense of commitment to work with us. And as Brenda said, to ensure that for the most part, we have the funding that we need. So I think the review of the funding ongoing will be critical with the input of operators and feedback from operators. So hopefully we can all move forward working together and sort through to end up with a great funding approach.
Yeah. I think it's certainly responsible to recognize that this is, one step towards many iterations of developing something that hopefully will sustain for decades to come.
Yeah.
I think something that came up in, folks had sent questions in advance. I'm seeing it in the Q&A here as well. Is just around, I think, providers. We're hearing from providers that they're concerned about a decrease in pay. They're concerned about what to expect. There's a question here, is legacy funding guaranteed? How do we know, can we be sure that providers will continue to be compensated levels they're at, or how we might even see advances in that? So maybe we can just take a moment here and focus on that provider perspective, and maybe what can they expect with the new funding approach and its rollout. Maybe I'll throw it to Brenda. Do you want to start us off on that one?
I think an important piece for everyone to remember is that legacy funding, first and foremost, is for 2025. So legacy funding is not something that's, you know, going to be a year-to-year concept of allocation. The intent of legacy funding for this year is to really give our municipalities, our province, time to understand the true cost. So it's going to sit in that separate pot of funding, and then they're going to tie together in the future, maybe 2026, maybe later. Hard to say, right? But I think that be really thoughtful about that piece, to know that the goal is that it's going to come in one predictable, streamlined piece of funding. So this year, understanding your costs, it's important to get that right. Providers are not going to make less. What they currently make, they will continue to make. And I think that that's an important piece for everybody to remember. That's not the intentionality of the province, nor the municipalities in that work of providers being paid less. However, the big question is, how do we increase provider compensation? So when we look at, 2022 rollout of freezing of funds, big impact for providers. 2022 and 2025, our costs are markedly different. And the ability for providers, if you run center-based childcare, you have opportunities to do more bulk purchasing to cover your food, your other consumables. You have other people coming in and doing, cleaning. Like there's all these inherent built-in pieces for center-based care that we have to figure out, how does this adequately get addressed for our providers who do really important work and are also isolated in their work, is that it's one provider. There is not an education team or complement of two educators working together. It is one person working alone with up to 6 children. And so we have to find ways to address that and to cover, those uniquenesses that Erin talked about earlier of what is the adequate compensation for overnight, for weekend, for non-traditional hours of care, so that incentivization and recognition of the importance and uniqueness of that is covered. We know that some of that's covered in our agreements already, if you had that in your existing funding complement. However, we need to make sure that it continues in there, and that's one of those other uniquenesses that we can see in the work that we do.
Anyone else want to add on to Brenda's comments there around what providers can sort of expect from the new funding approach?
I think Brenda said it all, Alana. However, I do reiterate what Brenda said. It is really important that providers understand they will not be getting less than what they are currently receiving, and that advocacy at all levels is happening for compensation, increased compensation for providers.
Great.
Yeah,
Yeah.
I agree as well. It's definitely, agencies are definitely looking hard at legacy funding. That is a huge aspect of this year's budget for us, so that we are making sure that our providers are not taking home less pay, and that they are, and the goal would be in the future is to see fair compensation for providers.
Yeah.
I think we're going to talk a bit more at the end about sort of next steps and how we can do some more of that together. But there's at least 2 more questions I'm hoping we can squeeze in here. And I apologize, we probably won't get to everyone's questions, but this came up both in advance and in the session. And folks are asking sort of about, what does this replacement of the grants? How are grants like the wage enhancement grant, base funding, planning time grant being rolled in to the new funding approach? What does that look like? Can we help make visible what that transition is for folks? And I don't know, Erin, if you want to lead us off on that.
Sure. So the intention with wage enhancement especially for CWIC eligible children, is included in the $155 a day. So the intention of it was for that all CWELC funds, and including general operating grants and special purpose funding, is that all comes together in one funding formula to make it more streamlined, and make it maybe a bit more predictable from municipality to municipality of what funds come from where. So the intention of that is for it all to be in one pot.
Anyone want to add any more to Erin's response?
I'd like to add a wrench into it, is that your PWE will be for 6 to 12, still calculated separately. So
Yes.
it's helping for one part of it, but for the other part, the expectation is that you will still have to do those reports separately as part of the work. So, as the hope and dream is that there's a streamlining of reporting, of funding and accountability. Let's also remember there's an extrication of licensed care still operates for 6 to 12-year-olds. So some of those things that you're currently doing from a reportability or a funding standpoint are still going to sit in that 6 to 12 category that needs to be streamlined in the future of that. So yes to, all of those pieces are supposed to be inherent in there. And we have to, as organizations, then take those deep dives into our funding to see, does it work out? Maybe, but we have to really, once we know our allocations better as individual organizations, we'll be able to understand that a bit further. And the Home Childcare Association, what you'll see in probably February, March, is going to be a survey out to membership to see where everybody is at, because January's too early to do that. February, same thing. I think we have to live through a month or two of seeing what's working, what the shortfalls are, so that when we continue the advocacy work that we do, we want to understand from our members what has worked, what hasn't worked, so that we can continue those advocacy efforts to advocate on behalf of both providers and organizations.
It'll be great to have some of that work ongoing as we move forward, and we know the Ministry of Education will be seeking feedback as well from the sector, so it's really critical that everyone's voices are heard in that process. There's so many good questions coming in, but one I wanted to pose that I think we hadn't quite talked about is in terms of expansion. Someone's asked, can you speak more to the flaws with the funding formula in terms of expansion? Who will this impact, and what are your recommendations to avoid these implications? Mary Lou, do you want to start us off on this one?
Yeah, I think expansion is definitely a good question. And we know that we can. Licensed home childcare is the place where we can expand. I think we just need to look at, as far as expansion, we need to look again at benchmarks. That 155, we want to be able to recruit providers. We want to be able to retain providers. So we don't want them to, because of benchmarks, not be able, for our agencies not to be able to recruit. So we need to have a recruiting strategy in place, for sure, a recruiting and retention strategy for licensed home childcare, and the funding to do so. And what exactly that looks like, I think we need to sort of see where we land with the funding and what components of that funding we can use to do that. I think we also need to look at how we expand the administrative burden to expanding. There is a process about looking at licenses and amended licenses. All of those pieces need to be looked at. And what is reasonable expansion for an operator? How is that determined? Should there be a percentage of expansion factored in? So I think there's all kinds of pieces that we can look at with expansion, but it's definitely a sector where we can expand.
And Erin, you'd sort of mentioned that in your opening comments as well. Do you have any thoughts on the funding formula and sort of what's missing in relation to expansion?
Yeah, so for me, there is an aspect of the funding formula that there is called a growth multiplier that you can apply to new homes. that's likely net new homes to your agency. So if you have a provider leave, then that's probably, and you replace it with another, not likely going to get that, but for any net new, you can apply for likely the growth multipliers that are in there. So that's sort of as a, instead of legacy funding, because you don't have necessarily legacy funding for new providers. So it's just something to think about too as we move forward with the new funding formula. As you expand, obviously you didn't have those legacy costs in 2023 when these are new providers in 2025. So something to just be mindful of as you expand is just to have those conversations with your municipalities about having enough funding for new providers is going to be really important. That would be one of the things I would just be mindful of as you're looking at expansion plans for home childcare.
Great, thank you. Brenda, anything to add to the expansion conversation?
I think when it comes to expansion for existing organizations, even though that doesn't fall under legacy, but there is growth funding, growth multipliers that Aaron was talking about. I don't think that the province nor the municipality would want our home childcares to have a two-tiered system, that one provider only makes this much and well, you're new, so you're going to make less. I don't think that's the intentionality around that. I think that that's something we just have to work through and work out as we grow and expand. I think where that will be slightly different is if a net new home childcare organization or a new home childcare license comes to an organization, that they're going to have to really look at addressing what their costs are. And so that is something that might be capped from a growth-based standpoint of understanding their funding. But I think for existing organizations who are expanding under CWELC with approved spaces, approved homes, I don't think that they want to create that further inequity. So I remain hopeful on that piece that for existing organizations that you'll be paying your providers the same regardless of whether they start in January 2025 or whether they've been historical or legacy in your organization.
Great, all these complexities, but it's great to hold on to that hope, Brenda. I appreciate you bringing that forward. Maybe just two quick questions, perhaps. This has come up, I think, in a number of answers, and I see questions running in the chat too. This sort of, I guess, the divide between CWELC and non-CWELC. Are there folks we're leaving out? Are there sort of winners or losers in the new funding approach in the sense that, you know, are school-age children going to carry a bigger brunt of the cost now? Sort of, what's your perspective on how that's going to play out, and administratively, is that something you're concerned about as well, this sort of two different approaches? And maybe we'll just do like a rapid fire response to that one, and Brenda, I'll invite you to start us off because you just left us off.
I think that's to be determined. I would hope that providers and families are winning, and if you're using that as a term, that they're benefiting, in my mind, that it works to serve both of them. That's my hope. I don't think that the brunt of the costs are going to be borne by school age. So I know that's been a historical funding formula for center-based care. I don't think that's the intentionality of this. So I think that, you know, if done well and done right, it equalizes itself out. But I do want to pay attention to the agency, and that the true costs of the agency from an oversight, mentoring, administrative piece are covered.
Aaron, anything to add to that?
Yeah, I think it's the same thing with, and just additionally, we don't know some of these pieces yet either. Some of the municipalities are still working through that as well. So echoing what Brenda said about that too.
Mary Lou, you're nodding. Anything
Yeah.
to add?
Total agreement.
That's wonderful. And then my last question before we pass off to Carolyn, and we'll do this really briefly. Mary Lou, we'll start with you. What's good about the funding approach? What do you feel hopeful about? And any opportunities here?
I mean, I think the funding, I think once we work through all the kinks, and I think we can get it right. I think it can be a streamlined funding with lots of flexibility for agencies. I think it supports families and children, and I'm hoping that we can really grow in the licensed home childcare sector, and maybe bringing some of those unlicensed folks into the licensed sector. So I think it's positive. I just think it's going to be a work in progress for a while. And I'm really hoping that they will engage organizations to participate as we review along the way.
Great. Erin, what are you feeling hopeful about? What opportunities are you seeing?
I think it's great that we're moving towards a
Mhm.
cost-based model. I think it's a great step in that direction, which would also include fair compensation for providers. Um, in addition to that, I'm glad they have put this legacy pot into place to help stabilize things as they move through this transition. And also really great that they're thinking still with us about the funding format, and that this is the first iteration and not the final iteration.
And Brenda, your final thoughts on opportunities and optimism.
Well, thank goodness revenue replacement is going. You know, I think that that's just not, it's not an accurate representation of costs moving to a cost-based structure. I think in the long run is going to be good. We just have to work through the bumps of the next year to really better understand that. And at the end of the day, you know, I go back to the fact we're building a system. Our country hasn't built a social infrastructure system since healthcare for everybody. And I'm sure that was probably a bumpy road initially to do that, but people have access to care. Is it perfect? No. This is the same thing that's the dream for this, is that families can access high quality childcare in their neighborhoods that meet their needs at an affordable rate that also has high quality, so that we're creating that. You know, we know the first years of birth to 6 are the most important developmentally in our lives. We're looking at representing that in one way. And what I would say, you know, all children deserve this. All families deserve that. That's the long goal of it. And as we're building this, what we need from everybody is to use your voice. Have those conversations with the municipality as you're rolling through this. And if it's bumpy or weird or something doesn't make sense, you got to bring it up. Share that information also with the Home Child Care Association, or share that with the AECDO, or share that with the coalition. We're trying to build a system and we need everybody's voice, because together we're stronger in the work that we do. So I would encourage, as we go through this, to continue to be involved, because without your voice we can't grow, and together we can help build an even better system. So I think that's what I would leave everybody with as a point of consideration.
Thanks so much, Brenda, and thanks everyone for being here in one of many conversations to come. Carolyn, back to you to sort of wrap us up.
Sure, thanks so much. And I think I speak for everybody, all the participants, over 100 participants here, in saying a big thank you to the panel. Thank you, Mary Lou and Brenda, Erin, and Alana for moderating. And just to move to sort of what some next steps are for us, one of the things that we talked about in planning this session is that, you know, the Ontario Coalition for Better Childcare and the Association of Early Child Educators Ontario and the Home Child Care Association of Ontario want to continue to work really closely together on this. I think a lot of the panelists made the point that, you know, this is just the first year. The ministry has said they're going to be making tweaks and changes to this as it goes forward. So, you know, our organizations, which are, you know, here to support the childcare sector, need that work to back from all of you folks who are implementing this and bringing that to the Ministry of Education. And so, you know, I know the Home Child Care Association had a technical briefing specifically on the funding formula. I think those are things that we'll continue to be following up with. There will be additional consultations. We also want to hear from you. We were able to get to quite a few questions, but there's, you know, even more. So we'll be looking at those questions, making sure we get those clarified, and working together to provide resources and some collective actions we can take as well. going forward. And so just, I know that we are at time. We have just one last minute left. So for folks who joined us today, and this was an open session, we just want you to know that our organizations, which are here to support the early learning and childcare sector in Ontario, we are membership-based organizations. So this is my last pitch to become a member of our organizations, because we are here to help support the early learning and childcare sector. So I'm sure folks can find where to find us online, but that's where you can reach us. And thank you so much for joining us today. We're going to continue to talk together to take our messages forward and make sure that we have an early learning and childcare system that supports Ontario's children, families with affordable fees for all, decent work and pay for early childhood educators and home childcare providers, and enough spaces in our communities for everyone who needs them. Thanks so much for joining us today.